There. Now to some cutting-edge medical news. Sydney bioengineer Dr Jiao Jiao Li is about to embark on developing a new drug using stem cells as biofactories, all in a bid to reduce inflammation and encourage the repair of painful osteoarthritic joints. Now, this new treatment could help the more than 2 million Australians living what is an extremely debilitating disease. And Dr Jiao Jiao Li joins us now from Sydney. Very good morning to you.
Hi. Yeah, really great to be here.
Great to be here and very excited to talk about your work. But firstly, just give our audience an idea of how debilitating osteoporosis is for so many Australians.
Osteoarthritis, actually. So osteoarthritis, I think if you were not already affected by it, you would know a family or friend who has it. It literally affects more than 500 million people worldwide and more than 15% of the population, and that percentage goes up to maybe 50% as you reach 60 to 80 years of age. So definitely a very debilitating disease. Yeah,
and so what are the, limitations with the treatment to date for osteoarthritis?
Well, if you present to the doctor in the clinic with osteoarthritis that is already causing a lot of pain in the joints, essentially it's pretty much already at an end stage where not a lot can be done about it. So, the mainstay is drug treatment or just physical, like in the earlier stages, maybe physical exercise programs to be able to try and relieve some of the pain and regain some joint function. But unfortunately, none of these current treatments actually help stop the progression of the disease.
Okay, let's get to the exciting part now. Let's talk about your work in using stem cells as biofactories. How is that work in practice?
Yeah, so currently using stem cell therapy to treat osteoarthritis is not a new concept. So there's maybe like a handful, about 10 randomized control trials going on around the world looking into stem cell therapy for osteoarthritis. Unfortunately, when I've presented at conferences, I've always had an orthopedic surgeon come up and say, yeah, I'm really glad that you acknowledge the fact that currently we don't see consistent long-term benefits of stem cell therapy in osteoarthritis treatment. And I think the problem there is twofold. So firstly, the majority of cells die actually after they get injected into the joint, and from the small percentage, like less than 5% that survive, from our latest published study, we have actually found that the osteoarthritic joint environment is a really inhibitory one. So it actually acts back on the stem cells, and then the stem cells start sort of going down the evil path as well. And that's not ideal. So what I'm trying to do is to instead use the stem cells as biofactories to produce like a magic potion of these bioactive factors that are the things that normally would downregulate, like reduce inflammation and cause or induce repair functions in the joint anyway, so that the cells themselves are not affected, and then we have just the beneficial biomolecules that can do the work.
How far along are you in this research development process?
Yeah, so we're at the proof of concept stage. My young lab at the moment has seen really promising results putting our magic potion of bioactive factors produced by the stem cells in cells that were isolated from osteoarthritic patients. So the results, the early stage results are really promising, and we're hoping that with this new support from the Metcalf Prize, we are able to really get to the next stage in the proof of concept, so testing it in a small animal model, and hopefully be able to be in the stage of designing a clinical trial in the next 6 to 8 years.
And we wish you all the best, and you and your great team.